Hi guys, it's me again. It's an unscheduled live chat. I know that this is last minute because it wasn't scheduled, but I wanted to pop on briefly just to give anyone the opportunity to ask any questions who wasn't able to ask questions yesterday. I'm hoping that today I will actually be able to see your questions live. As some of you know, in my live chat last night, I wasn't able to see any questions or comments live. So I'm hoping that today it'll be different. If not, I apologize, and it kind of defeats the purpose of the chat. But if you're on, please leave a comment and just say hello so that I can test out whether or not I am able to see questions and comments today. Maybe that particular technical glitch has gotten out of its system and I am able to see your engagement and interaction live. If not, I will do what I did yesterday and hop on my laptop and check questions and comments there. So while you guys are getting signed in and joining in the chat, I will grab my laptop so that I can go ahead and do just that. Give me a second here. Let me get signed in on my laptop. Let's see. Sorry guys, just give me 1 second. As always, please excuse my dogs and cats. They, you know, they like to sometimes make noise and sort of chime in to my live chats uninvited. So I don't think I'm seeing your questions and comments on my phone. Same thing happened yesterday. Hopefully, once I get on my Arthritis Ashley Facebook page on my laptop, I will be able to see them if there are any. Let's see. Let me try to adjust this a little bit. Let's see here. Okay, so I'm looking to see if any of you have asked questions yet. No, it doesn't look like it. Can you do me a favor though? If you're on, please say hello. Let me know that you're on so that I know if it's working or not. That's my Doberman in the background making really annoying sounds, in case you're wondering what that is. I wanted to let you guys know that after my live chat yesterday, I did go through and answer any questions that I missed during the chat. So I just wanted to let you guys know that you can go check yesterday's Q&A live chats that were done last night. You can look at part 1 and part 2. They are both on my Arthritis Ashley Facebook page. Or if you're on now, please feel free to ask a question and I will answer it, since we have been having technical difficulties on these chats lately. I know that some things we talked about yesterday were my dogs. They're always barking. Come here, bud. I apologize. It's every single time I do one of these chats, my dogs act like crazy animals, and I swear they don't just sit around. They don't do this all day. It's only when I start these chats. Hold on, please. Come here, Brutus. Come here. Hi. Okay. As long as I pet him and give him attention, he'll probably stop barking. At any rate, some of the things we addressed on the live chat yesterday, you guys had asked me, you know, when I was diagnosed and what age that was and what medications I'm on. We talked about stem cell therapy and a bunch of other things. We talked about some nutritional issues. I'm not sure what else we covered. It was a pretty long one. So I am starting to see some comments come in on my Facebook. I should say on my laptop, because I can't see them on my phone, which is really annoying. Let's see. Excuse my appearance today. My hair is kind of messy, no makeup. Smudgy eye makeup, actually, from this morning still. I had a busy day. Let's see. Okay. I'm at home now in my comfies, and I have a little bit of free time, so I thought I would come say hello to you guys. Hi Cassidy, how are you? So you asked me my thoughts on stem cell. I addressed this a little bit yesterday, and in short, I personally am really interested in stem cell therapy. I know that it's in its very early stages. It's not yet fully FDA approved as a treatment, in the sense that, you know, your insurance company is probably not ever going to pay for it. I mean, I don't want to say ever, but not currently. Insurance companies usually don't pay for it. It can be rather costly. If it's not costly and you're getting a really good deal on it, I would use some caution. Really do your homework, do your research, talk to people that have had it done at the facility that you're considering doing it at, because in all honesty, there are what I personally believe are some scams out there. I know that legit, reputable stem cell procedures are not cheap, and there's not a ton of, or like an overabundance of places that do them. So just be careful. You know, it's kind of like one of those you get what you pay for things. So there's a place locally, and I don't want to badmouth anywhere, but there is a place locally that is like an all-in-one kind of chiropractor slash weight loss clinic slash physical therapy and natural health place that claim they offer stem cell injections, but there's some kind of synthetic thing that they're injecting, and it's not the stem cell procedure that I'm talking about, which is where they actually kind of harvest and grow your own stem cells and use your own stem cells to rebuild cartilage and tissue. What I'm talking about is more of a surgical procedure that is, you know, like you go into a hospital or outpatient facility, and I think, I could be wrong, but I think it involves, you know, basically, for lack of a better term or a technical term, kind of sucking out some of your own bone marrow and using your own stem cells to kind of promote health and regrowth of cartilage and tissue. So these synthetic injections that are like $200, that's not what I'm talking about when I refer to stem cell. You might want to Google what the differences are, because I'm not an expert on it. I did say in my chat yesterday, I would recommend that you reach out to someone. Her name is Julie Cerrone. I might be pronouncing her last name wrong. It might be Cerrone. Sorry, Julie. It's spelled Cerrone. She's also from Pittsburgh, and she's a well-known health activist and patient advocate and blogger. She has some great YouTube videos. She's a health coach. She's a yoga instructor. She's awesome. She is a patient success story for Regenix stem cell therapy, and she flew out of state. I want to say to maybe Colorado. I don't want to. Don't quote me on that, but I think it was Colorado, and she had like the big legit real stem cell procedure done. She would be better at telling her own story than me, but from what I understand and what I've read and what I've heard and what she's told me, she went from being, Brutus, come here, being on crutches, walking with crutches all the time because of psoriatic arthritis and a vascular necrosis to, hold on, stop it please, come here. To being able to walk without them and have a lot less pain and things like that. And she actually did the stem cell procedure instead of a knee replacement. So she'd be a good person to talk to. Her blog is called It's Just a Bad Day, Not a Bad Life. So look her up if you or your friend want more, better information on stem cell therapy. She would be the person to talk to. I am going to a seminar on it in a couple of weeks, and then after that I'm going to schedule a consultation to see if I'm a candidate for any of my joints. I think my right knee and my right foot are too far gone. I'm probably going to need a total knee replacement soon on the right side, and possibly foot surgery in the future, but as we know, when you have rheumatoid arthritis and osteoarthritis, you have a lot of other joints still that can be affected. So I kind of still want to learn about stem cell and whether or not I'd be a candidate for future reference. So once I go and get a better handle on it and get a better grasp on all the information, I will gladly share it with you, Cassidy, and anyone else who asks. So let me see if there's any other comments or questions. Guys, I am willing to answer questions, so please feel free to leave a comment or a question. I'd love some talking points here. I'm kind of just freestyling. It's really frustrating that I'm not able to see the comments live, and I have to like have my laptop on while I do this and keep refreshing my Facebook. But it is what it is. You have to improvise in life sometimes, and that's what I'm doing here. While I await more questions, I will just chat. Nothing is new really as of yesterday. I took my Nana, my grandma, I call her Nana, to some doctor's appointments today, or rather a doctor's appointment, and then some follow-up errands like the lab and the pharmacy, and we went to lunch and had a busy day. It was just kind of funny though, because I have to go to the same medical building tomorrow and 3 times next week for doctor's appointments. So her and I are just a bunch of hot messes here. And even when I have a day off from the doctors, I'm at the doctor's, and I don't mind though. I told her that she's done so much for me in my life that I take no problem at all, you know, taking her to appointments and things like that, because I know from personal experience, it's sometimes nice to even if you can go on your own, it's sometimes nice to still have somebody with you, just for an extra set of eyes and ears to kind of absorb all of the information that's thrown at you, because sometimes medical stuff is like super overwhelming. So it's nice to take notes or have someone go with you to complicated appointments. So I'm happy to go with her, and really anybody that ever needs a doctor buddy. If you're local and you need a doctor buddy, I'm happy to help you out. I've driven friends to procedures and gone to doctor visits with other family members. I think that sometimes you need a whole team behind you as far as care goes, and it's really wonderful to have a support system of people that kind of help you cope and help you. Sorry, my Doberman's being super annoying. But he is part of my support system. But yeah, it's so nice to have people around you that can help you through medical things and help you cope with health problems. So I feel very blessed that I have that support system, and I'm happy, more than happy, to be that support for other people as well. Let's see if I have some more comments and questions. Right now, I'm in the process of awaiting test results and biopsies and all kinds of fun stuff, which is just so annoying. You know, I hate waiting. They always say no news is good news, though, so that's a positive. And I'm also waiting to get some tests scheduled. That part's annoying because it's like, how hard is it, you know, to schedule a scan? But, you know, sometimes you have to jump through hoops with insurance and everything. So I'm in the waiting process. I'm a little bit red today. I don't know if you can tell. Maybe not because of the lighting, but it's almost like ever since my last Remicade infusion, I have random food allergies and random allergic reactions to everything. So I ate a salad today with my Nana, and no clue what I didn't eat anything that I knew I was allergic to, and I got very rashy and red and hivey afterwards, and my throat hurts, and you know, I don't know what happened, but it definitely coincided with my last Remicade infusion. I mean, there's no way it was coincidence. I had one of these reactions right after eating fruit during my infusion, and then certain types of fruit that I never had an issue with. It's ever since my last infusion, it's been happening. So it's really weird. Today I didn't have fruit, but I had salad, and yeah, I've had kind of a lupusy looking rash on my face ever since, but it's finally dying down because I took some Benadryl and doTERRA Tri-Ease and prednisone, so we will see. Hopefully it goes away. Okay, more comments and questions. Yay. I much prefer answering your questions to just rambling about myself. You are welcome for the info, Cassidy. This is really weird. I thought I saw a comment from Michael, but it like went away. Let me try to refresh again and see if it comes back. This is the problem with the Facebook Live lately. It's had a lot of glitches where on my phone, where I'm actually, filming this, I'm seeing notes that are saying that people are joining the chat or viewing the chat, or that there's been, X amount of comments, 10 comments so far. I'm seeing that, but I'm not actually seeing the live comments like they used to scroll up while I talked, and they're not on there. So I have my laptop open, and I keep refreshing that, and I'll refresh it one time, and a comment will show, and then I go back to it, and the comment's not there. So, hi, Brutus. I thought I saw a comment from Michael. I think it said that he was annoyed that that stem cell is not covered by insurance yet. Pretty sure that's what it said. I was going to read it verbatim, but I can't find it now. So let me see if I can pull it up a different way here. Okay, here's a couple. I'm able to see a couple more comments now this way. Yeah, Michael said, why stem cell research and procedures are not funded still make me angry. So many other diseases could be helped if not cured by stem cell. I totally agree. I think part of this issue is that some people have a misconception about what stem cell therapy is. There's different types of stem cell research, and I don't want to get into politics. God help me, please no politics. But I know part of this is political and religious, that people automatically assume stem cell therapy with embryos and fetuses and embryonic stem cells, but that's not what we're talking about here. We are talking about therapy where you're using your own body's stem cells. So there's really nothing that controversial about it, in my opinion. But I think some of the research and funding and things like that are hindered, or there's some kind of stigma when you say something about stem cell, because I don't think people understand that what we're talking about now often is your own body's stem cell, not doing research on embryos or anything like that that could be deemed controversial. Unfortunately, politics get in the way a lot when it comes to healthcare and funding for research and healthcare programs. And again, without getting too political, a lot of what is approved and not approved in the pharmaceutical world has to do with how much money they can make off of it. Sadly, there's been some undercover investigations that show that sometimes even the treatments and the drugs and the therapies that doctors recommend are for less than upstanding reasons. Sometimes, more often in the past than now, they are getting a little kickback under the table or other kinds of perks. Brutus, please stop, buddy. Oh my gosh, my dog is being crazy. And there are tons of laws that are supposed to regulate pharmaceutical lobbying and the pharmaceutical industry and sales and things like that. That doesn't mean that there's not some dirty, crooked doctors and lobbyists out there. My dog is making the strangest noises and just like rubbing his nose into the carpeting. I don't know what's wrong with him. Honestly, it's so distracting, I can't even keep my train of thought. Brutus, please stop, buddy. Hey. Stop it. He wants me to pet him, but I can't reach him and talk to you guys at the same time. But yeah, so unfortunately, there's a lot of things that hinder research and hinder treatment options, and it's gotten a lot better. When opiates were kind of first introduced as a treatment, a go-to treatment for pain management and things like that, it was vastly different than it is today, and there weren't all the regulations on opioids, and doctors were getting a lot of perks by prescribing them. And so, even though that's gotten a lot better, it doesn't mean that these issues don't exist. There's a whole book about it, and I think a documentary called Drug Dealer MD. That's the book. There's also a documentary that I can't recall the name. If I can find it, I'll let you guys know. But it's kind of about the whole culture of prescribing and why doctors prescribe the treatments they do, and why the FDA and the USDA approve certain things and don't approve other things. And I think it's a shame that sometimes money and profit go ahead of patient care and health as a priority. Because, you know, the first part of, or one part of the Hippocratic Oath is do no harm. And I think that denying patients health care and denying patients treatments that could help them for the sake of money or padding pharmaceutical executives' pockets or, you know, budget reasons, I think that is doing harm. And so it's frustrating. My sense is that someday stem cell therapy will be approved, will be covered by insurance, and I hope more research goes into it because, Michael, like you, I agree that there's a lot of benefit to it, and I think that it could help treat or cure certain diseases in the future. So I'm hopeful for that day. I hope it'll help a lot of us with these conditions, or at least will help future generations. But it's a shame when you want to try something like that and you can't afford it. And unfortunately, I think that some things in terms of healthcare and coverage and what gets approved and not approved, I think that's only going to get worse. But I'll get off this topic now so that I don't get too political. But yeah, it is a shame because I think that stem cell could be wonderful, and I just wish that everyone was able to try it. I'm going to go learn about it, but I'm not real hopeful that I'm actually going to be able to do it because it's super pricey. So I mean, I'm probably going to have the knee replacement and maybe a foot surgery, but maybe by the time I'm ready to do anything else and actually go forward with stem cell, it will be approved. So that's what I hope. I want to believe in the best in people, and that includes the FDA and the USDA and the pharma industry and our doctors and our government, and I want to believe the best. I don't want to believe that there's any conspiracy to keep people sick. Although I will say sometimes it seems like there is. I know that's not true. I know that almost all doctors are good and have the patient's best interests in mind. But, you know, it is frustrating that there's so many illnesses out there without a cure or without treatments that work. I was just talking to somebody this morning about how frequently rheumatoid arthritis drugs plateau or fail or have side effects that are sometimes worse than the illness. It's a shame. And one of my prayers that I always have and that I say every day is that I wish that there were a cure for so many different diseases, cancer, any terminal or chronic illness. It just hurts my heart how many people are sick with how many different things. It's insane, and it seems like it's getting worse. And my grandma and I today were talking. I don't know if it's actually getting worse. Or more people have health insurance, and so they're able to go to the doctor and get a diagnosis. And what I mean about that is, we were talking about a recent article that said, I'm probably going to misquote it, so don't quote me on it, but there was a recent article out that was talking about how much colorectal cancers have increased in people under the age of, I think it was 30, and how certain other diseases just seem so much more prevalent nowadays, autoimmune stuff in particular. And, you know, we were trying to figure out, is it something in our food? Is it something in the environment? You know, what is it? What is it that's making people sicker? And, you know, there's several factors to this. I'm sure that, you know, the environment and air quality and, you know, things like that are probably part of it. But I think maybe some of it is food and GMOs and all of that stuff. But what I said is I don't know if things are more prevalent or they're just being diagnosed better and more frequently because more people have health insurance than ever, at least until recently, we'll say. I think more people are going to the doctor and more people are getting diagnosed with things, whereas in the past, if people didn't have health coverage or it was too expensive, they just wouldn't go to the doctor, so they wouldn't get the diagnosis. So the prevalence is then skewed. The other piece of this is people are more knowledgeable nowadays than back in the day. So like if someone's lower back is hurting for an extended period of time, yes, they might write it off as back pain, but I think some people, or a lot of people now know, oh, that could be my kidney. Or, you know, people realize nowadays that feeling sick after every meal is not normal. I think in the past people would brush stuff off as, oh, I just have indigestion, or, oh, you know, that meal just didn't sit right with me, and they would accept not feeling well. I think nowadays people are more educated and have more, I shouldn't say more educated, but have more access to information. So I don't want to say more educated. It's certainly not that. It's certainly not a matter of intelligence or smartness, but it's a matter of access to information, and we're inundated all the time now with information. So, I mean, you sign on to Facebook, Twitter, watch the news, pick up a magazine. There's so much information out there about health. So, you know, 50, 60, 70, 80 years ago, someone might have felt like a weird lump and kind of just ignored it. Well, now people think, oh, maybe I should go get that checked out. And, you know, in recent years, people, even low-income folks, were able to get insured. And so they would go to the doctor and get it checked out. So I don't know or not, I can't say for certain if things are more common, or if because of society changing that things are just getting diagnosed better, quicker, and more easier. While we're on the topic of prevalence and diagnosing and things like that, I want to give another shout out to the Autoimmune Registry, who I work with. I'm a patient engagement officer for them, and really what I want to do is get people signing up for the registry and sharing information about the registry, checking out our website and blog, donating if you can, becoming a board member if you can. What we're trying to do is establish this prevalence, the actual prevalence of autoimmune diseases. If you look at the site, and I don't want to misquote, so if my Doberman will let me type, I'm going to tell you this. So the prevalence project that is part of what the Autoimmune Registry does is it's really interesting. There is a paper dating back to 1997 that estimates about 9 million people in the U.S. have autoimmune diseases. Well, in the 20 or whatever years since then, it's been 14.7 million, all the way up to over 50 million. So that's a pretty big disparity. I mean, even in recent years, it's been as little as 5 to 9 million up to over 50 million. It's crazy that they can't pinpoint how many people in the United States actually live with one or more autoimmune diseases. So that's part of what we're trying to do. And why is that? It's so people can get the right diagnosis and get the right diagnosis quicker. Our president, who kind of came up with, he's the president and executive director, Aaron Abend, he started the Autoimmune Registry, which is a nonprofit. Because of his mom's Sjogren's diagnosis. She was told that it's a rare disease. And it's really not considered a rare disease now, but because it used to be classified as a rare disease, they weren't looking for it. The reason that's problematic is she was misdiagnosed, undiagnosed, brushed off, blown off, written off, and she suffered for quite some time. Well, you know, it turned out it's really not that rare of a disease, and finally she got the diagnosis that she needed. The reason that's a problem is because if something is categorized as a rare disease, doctors are less likely to actually look for it. There's this saying that if you hear hoofbeats, you look for a horse, not a zebra. The horse would be the more common diseases or more common conditions. So a person that's a little older comes in with dry mouth, dry eyes, you attribute it to old age. Or the climate or whatever. You wouldn't look for, at the time, what was a rare disease, which was Sjogren's syndrome. Now, it turned out she had Sjogren's, but it took her far longer to get that diagnosis than it should have, all because it was categorized as rare when it wasn't. So we are trying to figure out the prevalence to help decrease diagnosis time so that people get quicker diagnosis. We are trying to increase awareness and funding for research relating to autoimmune diseases. And we want to become a hub for researchers to pull up data and statistics about patients with autoimmune diseases and those diseases themselves. So check it out, autoimmuneregistry.org. You can make a difference just by sharing your story. It's a quick, easy, free, safe, simple, secure survey. If you have any questions about it, let me know. Please share it with your friends who may also have autoimmune diseases. Yeah, so I'm back on to see if there are other questions and comments. Let me see here. You're very welcome, Dee. She said, thank you for speaking on this issue. Pushing pills. I have a rare blood disease, no cure, it can kill me. You deserve your medical, you deserve medical rights. And yeah, I totally agree. It's a really an important issue, this whole, the notion of doctors that basically are pill mills and things like that, and how important healthcare is. So thank you for your comment, Dee. Katie said she's signing up for the autoimmune registry now. Thank you so much. I really appreciate it. If you have any problems with accessing the registry and filling out that survey, let me know. It takes a minute to load, not an actual literal minute, but it takes, a little bit to load once you get to that page. Just give it a second though. It will be there. You enter your email address to start. And then mostly it's demographic type information, you'll see. It's pretty easy and it's not that long. It doesn't take that long at all. And it's for a great cause. So please fill out the survey. If you feel called to donate, please do. But really you are doing your part just by participating. Dee asked, where is the survey? So go to autoimmuneregistry.org, spelled just how it sounds, autoimmuneregistry.org. Once you get to the homepage, it says living with an autoimmune disease, your story counts, join our registry. You can either click join our registry right there, or there's a green box below that says join our registry. Or you can go up to the top menu and go to for patients, scroll down under the for patients category and click join our registry. Once you get to that page, it will take a second for the registry to load. At first it just says join our registry, and then sometimes it takes a minute for it to pop up. Once it pops up, it says sign up. And there's a place to log in if you're a returning user, or a place to log in if you are a first-time user. Again, give it a second. Once you get to that join our registry page, it can take a minute. Again, I need to stop saying a minute because it's not literally a minute to take or to pop up. But also on the home page, if you go back to the homepage of autoimmuneregistry.org, you're able to view autoimmune statistics, look at recent blog posts spotlighting different autoimmune diseases. You can check out some articles about us, places to donate, a list of autoimmune diseases and rare diseases. And then there's something that says explore our data. What's interesting about that is you click on explore our data, and or you can go to the section that says for researchers, and it launches the AR Explorer. Patients and researchers are able to use the Explorer to find out how many patients share your specific symptoms. So it's really interesting. The version that's on our website is the public version of the AR Explorer. You can apply for a special access if you're a researcher. So cool. Yeah, let me know if you guys have any more questions about the autoimmune registry. Michelle asked how you become more involved. That's a great question, Michelle, and I really appreciate it. We are always looking for volunteers. We are really looking for board members to help with fundraising. And we are really looking for donations as well to keep the registry afloat. We are a certified 501c3 nonprofit. So if you want to become a volunteer, or you or someone you know would be a good fit as a board member, please let me know. If you want to donate, which would be super helpful, even if it's a small amount, you're able to donate right through the website. There's a couple places that ways that you can get to where you can donate. From the homepage, there is a donate now button. You can also, on the top menu, go to About Us and then go down to Make a Donation. Yeah, so that's our need right now. We're looking for guest bloggers about specific autoimmune diseases. So if you want to be a guest blogger, you could do that. Spreading the word of mouth is great. So share information, share the link to the autoimmune registry, like the autoimmune registry on Facebook and share that stuff. Follow autoimmune reg on Twitter. It's AUTOIMMUNEREG on Twitter. Will be coming soon to Instagram. But again, the best way to get involved, join the registry by filling out that survey. Donating, we need donations to keep running. Become a board member if you would be able to do that, or recommend a board member to us. We need help fundraising. Or volunteer your time. There's a lot of administrative needs and fundraising needs and things like that. Eventually, we're hoping to launch, once we get further set up with Network for Good, launch peer-to-peer fundraising pages. So you'll be able to create your own fundraising page where people can donate. This is similar to like when you sign up for a walk or a run or a 5K or a charity event. You can start a team or have people donate that way through your own page. Hopefully we'll be getting something like that going in coming months. Sorry guys, I'm a little out of breath and short of breath. This has been happening lately. It's really annoying. It's part of why I'm undergoing all those tests. But I'm fine. I'll power through. Yeah, it usually happens when I get this flushing thing and talking a lot. But let's see. Someone commented, "Gotta love silly dogs." I agree. They're so funny. Brutus is always making weird noises while I'm doing these chats, and then Maggie's always snoring and snorting and grunting. She's the pug. And then my little Chihuahua mini pincher mix is always just like hopping around everywhere. And the cats are pretty chill, but sometimes if I'm at a table, they'll just kind of walk across the keyboard or walk across the table. They're pretty funny. Let's see. Yes, Michael said exactly my point, Ashley, going back to the stem cell therapy and how certain treatments and therapies aren't really as accessible or affordable as we would like. Michelle asked me what type of arthritis I'm diagnosed with. Michelle, I was originally diagnosed with juvenile rheumatoid arthritis, now called systemic juvenile idiopathic arthritis. It's an autoimmune form. I was diagnosed in childhood. There's been some discrepancy and debate whether it was polyarticular or polyarticular, but it was one of them. Now he says polyarticular, but I don't know. But it was JRA, now called JIA or SJIA. I've also since then been diagnosed as an adult with RA and OA, osteoarthritis. But I also have secondary to the RA-JA. I have secondary Sjogren's syndrome and secondary like a lupus overlap syndrome. So it's not classic SLE. At one point they said it was drug-induced lupus, and then I went off that medication, so now it's kind of just like, I don't know. They just call it lupus overlap syndrome, mixed connective tissue disease. And then I have some other pain conditions like mild dystonia, which is chronic spasming of the muscles. And what else? Osteopenia, which is the precursor to osteoporosis. And then I have some other autoimmune things like celiac disease, and I have an autonomic nervous system thing, which is called POTS, postural orthostatic tachycardia syndrome, with sinus tachycardia, which is a little heart arrhythmia, but it's pretty sporadic. I have a history of Chiari malformation, Arnold Chiari malformation. I had brain and neck surgery for that in 2011. What else? I have chronic migraine syndrome, chronic migraines. I think that's all. I mean, at the beginning of my book, Sick Idiot, I list over 3 dozen different diagnoses I've had since childhood. Some of them still exist today and were chronic and ongoing and possibly lifelong. Some of them were acute and eventually went away. So yeah, I have been diagnosed with arthritis and then some. I have hit I was going to say the trifecta, but it's certainly beyond the trifecta now. I guess I've just hit the jackpot of chronic illnesses. And I've been misdiagnosed with some things in the past too. For years, a lot of my symptoms were written off as fibromyalgia, but I've seen several doctors, rheumatologists. Many have looked and tested, not tested, but evaluated, where my symptoms are, where my pain is, where my discomfort is, and have concluded that it isn't fibromyalgia because it's not conducive to what the typical points are for fibromyalgia. And enough of my labs have been abnormal to where there are other diseases that just make more sense. But prior to some of my newer diagnoses, I was diagnosed with fibromyalgia. It turned out to be a misdiagnosis. I ended up having Bell's palsy in college, which is facial paralysis. And that was actually, there was a lot of weird, vague symptoms leading up to that, which I think were confused for fibro. And then I was told that my headaches were depression, anxiety, whatever. I'm a female, so of course my symptoms are psychosomatic and in my head, and emotional because I am a hysterical woman. If you can't read my sarcasm, I'm obviously being sarcastic. My headaches and neurological symptoms that they wrote off as depression and anxiety turned out to be Chiari malformation, which I needed brain surgery for, and chronic migraine syndrome, which I have pretty badly, and I have some hyperalgesia from that too. So it's funny because my experience actually fits in very well with an article I wrote recently for Healthline.com. This Healthline article was also picked up by Huffington Post and the United Nations. It is about, sorry, my hair is bothering me, about gender bias in healthcare. So there is a subconscious, unconscious bias, meaning it's not always intentional. It's not intentional sexism or anything like that. It's not like these doctors are all misogynistic. But there is this unconscious bias kind of against women when it comes to taking women's symptoms as seriously as they would take their male counterparts. And this isn't something that I just made up. There is a lot of data and a lot of commentary, qualitative and quantitative data to support this, that doctors, both male and female doctors, whether intentional or not, do tend to take men's pain more seriously. So that's really interesting, and I discuss this a lot and reference a lot of resources and studies in this article. Sorry, my nose is so itchy. I'm having a lot of problems today. But yeah, if you want to check that article out, let me Google it and see exactly what it's called so you can find it easily. My dog is licking my arm and pushing my hand away from the keyboard. Buddy, I need to type something. Please move your big head. Okay, let me see here. Okay, so I think the article is just called, Is There a Gender Bias? Is there a gender bias against female pain patients? You can find that on Healthline.com. You can find it on the Huffington Post, and the UN also tweeted it out, the United Nations Women page. Or you can go to Google News and just search my name, not Arthritis Ashley, but my actual name, which is Ashley Boynes Shuck. ASHLEYBOYNES-SHUCK. Check out that article. It's all about gender bias, and yeah, I think that gender bias is part of why I've had some misdiagnosed conditions along the way, but it's certainly not a huge factor. I think my doctors learned pretty quickly that I know my stuff, and I'm a pretty educated and empowered patient, and I do not take kindly to mansplaining, so most of them are no longer condescending towards me, and most of them take my concerns pretty seriously. The doctors that know me very well know that I am not a big complainer or a hypochondriac, and I think at this point they've seen my medical records, which are all, I have about 3 binders this thick, and just pages upon pages in the computer. So they've seen my labs, they've seen me in the throes of certain symptoms, and I think at this point they take me seriously, but when I was younger, they didn't, but I also didn't stand up for myself as much when I was younger. So thank you, Mom. If you're watching, hi, Mom. My mom's Sharon. She taught me to have a backbone. I used to be a doormat and would let everyone just walk all over me, including medical professionals. And now I am the steward of my own health. I am the captain of my own ship when it comes to my health care. And I will fight tooth and nail to get the tests I want, the medications that I need, while also maintaining a really respectful dialogue with the doctors. I think it's really important to have respect go both ways, patient to doctor and doctor to patient, and the same goes for nurses. If I'm being treated with respect, then it's going to go better, because if I'm not being treated with respect, it's hard for me to then respect them and trust them. I think that trust is often established through communication and respect, and I am never rude to my doctors. I try not to be rude to their staff, but I will voice my concerns and voice my opinions when it comes to my health and my body. I know that some people, for some unknown reason, consider feminism or being a feminist a bad thing or a dirty word. I think these folks have a misconception about what it means to be a feminist, but I certainly am one, and I am a strong female and an empowered patient. I think that you have to be, when it comes to making medical decisions in your healthcare, you have to be in charge, and you have to remember, if I'm going to spew out advice and be here on my soapbox, for risk of sounding preachy, I do want to say that you're in charge of your health and you're in charge of your decisions. So if you feel extremely uncomfortable with a procedure or a medication or a recommendation, or you're questioning a diagnosis, never hesitate to ask questions. Never hesitate to assert yourself. The doctors may get annoyed. Trust me, I know some of them do get annoyed when I am being pushy or asking questions, but if I weren't pushy and I didn't ask questions, there would have been several conditions of mine that would have gone undiagnosed. I would have been on drugs that were dangerous for me, or undergone a thyroid, removing my thyroid for no reason at all, because it turned out to be nothing. So ask questions. Don't be afraid to ask questions, and don't be afraid to voice your concerns, and remember that the final medical decision is up to you. So work with your doctor, okay? It's not like you have to respect what they say and take their knowledge and their experience and their education obviously into consideration. They know what they're talking about, but that doesn't mean you don't, and it doesn't mean that you don't know your own body, and it doesn't mean that you're never allowed to disagree with them. I mean, you are allowed to disagree with your doctor. I know some people don't think so. I mean, I know people that have been prescribed medications, and you'll ask them, well, oh, I moved my chair. My dog freaked out. You'll ask them, like, what are you on that for? And they're like, I don't know. And it's like, well, why are you taking it then? You know, if you don't understand why you're on a drug, you need to ask, and you need to find out. You shouldn't be taking anything unnecessarily. You shouldn't be taking a drug if you don't know what it is or how it works or what it's called or what it's for. Just be mindful and be aware. Be an educated, empowered patient. That doesn't mean you get to walk all over doctors and their staff and play doctor and self-diagnose and consult Dr. Google, because they are, they know how to do their job. 99.9% of them probably are wonderful and quite capable. Often all we hear are the horror stories and the stories about the bad doctors and the quacks, but most of them, know their stuff. But just because they know their stuff doesn't mean they're never wrong, and doesn't mean that they're always right for you, because especially when it comes to autoimmune conditions and a lot of chronic illnesses, the symptoms vary so much from patient to patient, and so do patients' responses to treatments and medications and drugs and whatever. So what works for one person doesn't necessarily work for the next person, and there really is no such thing as a textbook case for a lot of these overlapping autoimmune syndromes. So that's important to remember. My point is that you're allowed to be assertive, and you're allowed to you're allowed to question your doctor, and you're allowed to have the final say about. Brutus, come here, bud. Pip, no. Sorry, you're allowed to have the final say about your treatment and what goes in your body. And come here, buddy. Come here. This time of day is tough. People are coming home. Come here, Brutus. Come here. Come here. So yeah, you're allowed to. Come here, buddy. Come here, bud. Come here. Come here. Come sit with me. Come sit with me. Okay. You're allowed to make your own call. You're the driver of your car, I guess. I don't know. I was about to mix metaphors there. You're the captain of your ship, is what I'm trying to say. And or we could say that maybe you and your doctor are co-pilots of the plane that you're on. You should work together, and you should both be respectful of each other. I don't know how I got on that tangent, but it's something really important to remember. Let's see. I'm refreshing the Facebook comments so that I can see if there's new comments or questions for me. Yes, you have to be empowered and your own self-advocate. I agree, Michelle. Brittany said, oh, she said, I am so full of knowledge. That's flattering. Yeah, so I have been asked by several doctors if I am a nurse or a doctor or somehow in the medical field. I'm not exaggerating. There have been probably 3 or 4 at this point different doctors who've asked me because unfortunately I've had to become educated and knowledgeable on this stuff. You know, when you deal with health problems since childhood, you know, I feel that you really have no choice. You either have to you know, take it by the reins or just let things happen to you. And I spent too long just letting things happen to me, and it didn't come out with the best results. So, yeah, thank you for the compliment. But I don't know if it's knowledge so much as just experience. And I, you know, I kind of wish sometimes I didn't have to have the experience. But I'm glad that I understand it. You know, I understand medical things and terminology and kind of how things work, how the human body works, and I'm grateful for that. I'm grateful to have that level of understanding because a lot of people do not, and I feel bad that people go to certain doctors that just throw all the jargon and the technical terminology at them, and people leave appointments just feeling flustered and flabbergasted and so confused. A lot of doctors don't have time to sit there and put everything in layman's terms and talk colloquially and conversationally with a patient and spend all the time in the world with them, and that's no fault of their own, trust me. I know doctors are so busy, and most of them do the best they can in terms of bedside manner and explaining things thoroughly. And they always say, you know, do you have any questions? But some people don't even know where to begin. I mean, don't even know what question to ask because it's just so much information and so overwhelming. So I do feel for people in that situation. But I think most doctors are pretty good about making sure that people understand what they're dealing with. There's something in my eye. Oh, D, this is so crazy that you said this. D said, oh my God, please look up acute intermittent porphyria. You have everything diagnosed, same as me. So funny you said that. Not funny, but I have been under evaluation for acute intermittent porphyria, hormonally induced. Specifically, it's I can't talk. Hormone-induced acute intermittent porphyria. So hormonally induced AIP. Oh, so annoying sometimes. I love them dearly, but I do not know what he's barking at. I thought it was cars and like people coming home from work, but I think it's the wind outside blowing stuff around. We have some crazy wind and crazy weather here this week. Yeah, I've actually been under evaluation with a hematologist for porphyria now she's been running tests on me off and on for several years. One of my porphyrin studies was elevated, and she was pretty sure I had it, but then every other subsequent urine test that I did for porphyria was negative. It was normal. So it's really weird because she was like, okay, if you don't have carcinoid syndrome, if you don't have pheochromocytoma, if you don't have mastocytosis, and you don't have a myoproliferative blood disorder or some kind of cancer, like, it's probably porphyria. She really was evaluating me for that and something called P. vera, which is, I think, polycythemia vera. I ended up, my bone marrow tested negative for polycythemia vera, but like I said, there was one time that my porphyrins were elevated, and so my hematologist thought maybe I did have porphyria. Again, the type that you're referring to, acute intermittent porphyria, hormonally induced, but my tests were never positive again, so she wasn't really able to, like, give me a final confirmation whether or not I had porphyria, but it seems that whatever I'm dealing with is often triggered by medications, and usually anti-TNF drugs, you know, the TNF inhibitors like Remicade and Enbrel. But lately it's triggered by food. So I don't know if maybe the Remicade kind of triggered a latent or dormant food allergy. I still am under evaluation for carcinoid syndrome. I should be having a scan in the next week or two. Plus waiting some biopsies for that. But yeah, for the AIP, I've done 4 separate urine studies, and those are 24-hour urine studies. And I've done several blood tests, and there was only one time that they were even slightly elevated. So she really strongly doesn't seem to think now at this point that it's porphyria, and she's a really good doctor. I mean, she's a hematologist and an oncologist, and she seems to really know her stuff, and she's had patients with porphyria, so she knows about it. I've done so many tests that it would be hard to say that I do have it at this point. I've had a bone marrow biopsy, I've had a million 24-hour urine studies, every blood test under the sun. Yeah, so I don't know. It always was a question mark, and it never was formally diagnosed. At this point, they're leaning towards it being kind of a mastopsychotic type, not psychotic, but I was going to say mastocytosis, but something to do with a mast cell disorder. That's what I'm trying to say. They are now leaning towards it being like an allergy or an immunologic response or some kind of mast cell disorder. Maybe carcinoid or something neuroendocrine. We don't know. It could be autoimmune. We have no idea. It's a big mystery. It's been going on forever. I mean, I started with all these symptoms in 2012, got better, got worse again. Usually seems to coincide with when I'm on a biologic, like Enbrel or Remicade. So I have no idea. Dee said it's called tic-tac-toe disease. That's interesting. I didn't know that porphyria was called tic-tac-toe disease. I know sometimes people joke about porphyria being like a vampire thing, like it's vampires that get it, because a lot of times it's triggered by the sun, which actually today, the rash on my face sort of was triggered by the sun, so that kind of makes sense, but at the same time, photosensitivity goes along with a ton of autoimmune stuff, including lupus, so who knows. Brittany said, I'm so positive. Thank you. I try to be. It's really hard sometimes, but I do try my hardest to stay positive and be strong and keep the hope and keep the faith. Let's see. I'm going to see if there's any more comments because, like I said, I'm not seeing all of them in order. So let's see. I don't know what one of the comments means. Sorry. Michelle said she has RA and polymyositis. I've heard of polymyositis. Is that multiple muscles that are inflamed? Autoimmune, right? Sorry to hear that. Lauren, you're so sweet. Thank you for your comment. You're inspiring too. I love your fitness journey and everything that you do. Michelle said she loves pets. So do I. They're a handful sometimes. I have, like I always say, I have 3 dogs and 2 cats and a dog that I share custody with my mom, I guess, my parents. She now lives with them and they take care of her, but she was my doggie, Lucy. But yeah, they're awesome. I mean, I love my pets. They're a handful. Dee said some insurance don't pay for rare tests. Yeah, so you're going back to the whole 1 out of 20,000 acute intermittent porphyria. Yeah, it's a rare disease. Another reason why it's hard to get a proper diagnosis. I do really trust my doctor that's been testing for it, though I have to believe that if I had it at this point, she would have found it. I mean, if you would see the amount of porphyria-specific urine tests and blood tests that I've had, you know, but that one that was abnormal makes me a little bit nervous that, like, maybe I do have it, but I don't know. I don't know. We'll see. We'll see what the carcinoid tests show. And I meet with the allergist soon, and a pulmonologist, and my knee surgeon. We'll see what all of them say. Michelle asked a good question. Why don't doctors have to report those stats? Going back to the conversation about prevalence, I don't know. They might have to, but how do I put this? But they might be misdiagnosing people because the prevalence isn't right. So what I'm saying is, if more people have, I'm just going to make up a disease. My dog's a Doberman. He's walking around. We'll say Doberman disease. So say like they think that there's 70,000 Americans affected by Doberman disease. And then there is, looking at my cat, he's an orange tabby. So orange tabby disease. Then there's orange tabby disease that 5 million Americans have. Doctors are going to be more likely to diagnose the orange tabby disease because there are more people that have it. It's more common, so it's more likely that you would have it. So when they report statistics, if they are required to report them, I don't know, they're going to be reporting for orange tabby disease, and maybe years later, they find out that the person has Doberman disease. So stuff like that is what skews these statistics. So I don't know if doctors are required to report stats of prevalence and report on these diseases, but if they are, they're only reporting what they know. So if they are assuming a patient has orange tabby disease and not Doberman disease, then orange tabby disease is what's being reported. So that then skews the prevalence of Doberman disease. So sorry to Brutus and Theo for using their breeds as disease names, but I just wanted to use a placeholder there instead of an actual condition. But that's what happens. Unfortunately. And it's to no fault of the doctors or anything. It's just autoimmune diseases are so complicated and complex, and some of them are really rare. So it has to be hard. They share commonalities, and they share a lot of symptoms with other diseases. So a lot of these autoimmune conditions look and act alike. And the same goes for some rare diseases too. So it's sometimes hard for them to really diagnose. Even with like RA and lupus and Sjogren's, there's a lot of overlap in the tests. And so sometimes you might be diagnosed with one when you don't have it and you have the other, or you're diagnosed with all of them and you only have one of them. It's hard to say. It's really hard to say. So I give doctors and nurses and researchers a ton of credit because these diseases are complex and confusing and complicated. Going back through the comments again, because of course I couldn't see them live like a normal person. I don't know why technology is against me lately. So I'm going back through some good comments here. Michelle also said, nobody lives in your body but you. And that's true. So that's why you have to be your best advocate for yourself. You're welcome, Dee. Going back through. I think I answered all the questions so far. Yeah, Michelle said she thinks pharma companies want to keep us sick. I'll stay away from that one. I have mixed feelings. I think there's good and bad in everything and everyone. So I'll just leave it at that. Every industry. So there's pros and cons to the way they operate and the way they behave and what their goals are. I understand that medicine is business and healthcare is a business. My thoughts in life are always people first. I'm a person who puts people first and love first and compassion and empathy and kindness first and health first. All of those things and the non-material things like experiences and memories and moments and feelings and emotion and art, you know, those things matter to me a lot more than material things and money and a bottom line and a budget and wealth. The financial stuff is just never going to be as important to me as quality of life or the life you know, the people you're sharing that life with.